Dermatology MCQs asked in UPSC 2020 examination is the topic of discussion for this video. Hello everyone, myself Dr. Maddineni Srinivas Dermatologist from Bharat, discussing derma related topics in my YouTube channel. So let us begin the discussion without any further delay. This is the first question. If you know the answer for this, please put it in the comment section. Which one of the following antigens is commonly associated with the causation of the farmer's lung? So yes, the answer is actinomyces. Actinomyces is the correct answer for this question, right? So next, let us see this question. All of the following are causes of exudative pleural effusion except. So among the given options, the option D is the Meek syndrome. What do you think is the correct answer? Please remember, dear students, fungal infections, systemic lupus erythematosus, and also Meek syndrome, all of them can cause exudative pleural effusion, whereas SVC obstruction, superior venical obstruction, is going to produce the classically the transudative type of the fluid. So that is the correct answer for this question, which is an exception, which is asked in this question. Next, you have this. All of the following are associated with glomerulonephritis with low complement level except. So please remember, dear students, subbacterial endocarditis, systemic lupus erythematosus, cryoglobulinemia, all of them are associated with the glomerulonephritis where there is going to be hypocomplementemia, whereas in IgA nephropathy the complement levels are going to be normal. There is not going to be any low complement level, right? Coming to the next question, consider the following statements regarding the oral aphthous ulcers. You need to tell which of the following are correct. So what are they? They are superficial and painful, absolutely correct statement. They may occur in women just prior to menstruation, absolutely correct. Oral glucocorticoids may be needed for the treatment of a severe recalcitrant or recurrent cases, absolutely correct. They are pre-malignant and progress over a few years to squamous cell carcinoma of the oral cavity. This is wrong statement. So we have this 1, 2, 3 which should be the correct answer, right? I hope it is clear. Next, this is a question. So young medical student working in HIV ward got pricked accidentally on the finger with a syringe needle which was used to draw the blood, okay, whatever it is. So now which are the following is the therapeutic intervention which is best interest of this particular student? What do you think is the correct answer? We have to give the 3 medications which are going to be the dolutegravir, tenofovir and emtricitabine. That is going to be the correct answer for this question. And also you should remember the duration is going to be for a period of 4 weeks or 28 days. In fact, this was also asked in the same paper as a different question. We will also see that question also. Cryptococcal infection is acquired through. What do you think is the correct answer for this question? Cryptococcal infection. So please remember, it is going to be the inhalational route through which Cryptococcus is going to come in contact, and this is going to be present especially in the pigeon droppings, which is a very big headache in metro cities, right? Pigeons. And of course it could lead to life-threatening cryptococcal meningitis. So very important topic which you have to know. Echinocandins are a class of antifungals. This is just like a one-liner which you can remember, okay? So extrapulmonary sites which are most commonly involved in the tuberculosis are all except, yes, lymph node tuberculosis. It is in fact the most common extrapulmonary site. And in the skin, what is it going to produce? Most commonly in the children, it's going to produce a scrofulloderma, okay. Genitourinary is also very common. Skeletal TB is also common, but remember the skull tuberculosis is very rare. So that's going to be the correct answer for this question. Post exposure prophylaxis for HIV should contain. So this is what I have told. It was asked in the same paper twice. So it will be 3 antiretroviral drugs for a period of 4 weeks. We have already seen what are the drugs. So let us see the next question. All the following are seen in the marasmus except. So what do you think is the exception here? Yes, in the marasmus child, we are going to see the reduced triceps skin fold, reduced mid-arm circumference is also going to be seen, decreased body mass index is also going to be seen, BMI is also going to be seen, whereas protein wasting is not going to be seen in the children of the marasmus, okay. And in fact, it is a hallmark feature of the kwashiorkor but not marasmus. So kwashiorkor marasmus are very important topics which you should know definitely. And this is the next question which says 20-year-old lady presented high grade fever for 5 days. Palpable purpura present over the extremity. She is found to be confused. There is neck stiffness, which are signs of meningitis. What do you think is the most likely diagnosis in this case? So please remember, dear students, Neisseria meningitis producing acute meningococcemia is the diagnosis which you have to definitely have in your mind whenever this kind of meningitis features along with purpura is the presentation in the patients. Right. Next question is regarding the diffuse cutaneous systemic sclerosis. You need to identify the poor prognostic markers among the given options. Right. Older age is definitely a poor prognostic marker. Proteinuria, that is telling that kidney involvement is there, is also a marker. Diffuse skin disease is also important, poor prognostic marker. Whereas it is not high gas transfer, it is a low gas transfer factor which is going to be the poor prognostic marker. But since high is mentioned, so 2 cannot be there in the option. So we are going to choose 1, 3, 4 as the correct answer. And of course, these are all the poor prognostic markers: older age, high ESR, significant renal involvement, which manifests as proteinuria, and also diffuse skin disease. And also you can remember the pulmonary fibrosis and pulmonary arterial hypertension. These are also poor prognostic markers for diffuse systemic sclerosis. Next, it is again related to HIV, or we can say needle stick injury. So what are the do's and don'ts in this case? Injured part should be washed under running water, absolutely correct. Dominant index finger is not the commonest side for the needle stick injury. So dominant hand is going to be used to fill in the syringes, whereas the non-dominant hand usually will hold the skin with the non-dominant hand, will try to inject, and if there is a slippage, the non-dominant hand, thumb and the index finger are the ones which are going to be affected most commonly, but not the dominant hand. So it is wrong. All needle stick injuries should be reported, absolutely correct. Hepatitis, HIV testing should be done after needle stick injury, absolutely correct statements. So we have the answer as 1, 3 and the 4. 1, 3 and 4 are going to be the correct answer. Okay. So coming to the next question, it is, which of the following is true about the phelon? Except, so all the following are correct except, so which is wrong about the phelon? So there is infection of the fingertip, this is correct. It is incision tetanus treatment of choice, this is a correct statement. It is common in diabetics, absolutely correct. It is very painful but not painless, so option B is the exception among the statements. Next is related to stages of the pressure sore. So here instead of seeing the options whenever you get these kind of questions, always try to recollect what are the stages of any condition or any disease. If they are asking, you should by heart remember what are all the stages. So here please see, in the stage 1, in the pressure sores, epidermis is going to be involved and the skin is going to be intact. Whereas in the stage 2, there is going to be partial thickness skin loss, where the involvement could be in the epidermis or even up to the level of the dermis, where there could be the friction ulcer and also a wound which is going to be present up to the level of the dermis. Stage 3, there is going to be full thickness skin loss even up to the subcutaneous fat level, that is a hypodermis also could be affected in the stage 3. Whereas in stage 4, what is going to happen? Obviously, there is going to be the fascia involvement in the stage 4. So what would be the correct answer for this question which was asking stage 3? Obviously, it is going to be the subcutaneous tissue but not through the fascia. That is going to be the correct answer for this question. Right. Next MCQ says, which of the following is not true of the pyoderma gangrenosum? Please remember, dear students, this term, this disease is actually a misnomer. Pyoderma gangrenosum is not a bacterial infection of the skin. It is a neutrophilic dermatosis of the skin, in which patients are going to have rapidly progressive, very painful ulcers over the extremities, and these ulcers are going to have the undermined edges, and at the margins you can see violaceous hue will be there, that is purple hue will be there, and it is often secondary to heightened immunological reactivity from another disease process. That is, these individuals usually have an underlying inflammatory bowel disease, or they can have the rheumatoid arthritis. So as an extra articular and extra intestinal manifestation, pyoderma gangrenosum is going to be seen in these patients. Lesions generally respond to steroids, absolutely correct statement. So what is the left out? It is option C. It is not basically a bacterial infection, so the gram-positive staphylococci will not be there in the culture. So that's going to be the wrong statement in this case. Next question is related to the OBG and also STD dermatology. Trichomonas vaginitis. Which of the following are the characteristic features of Trichomonas vaginitis? You need to identify among the list. So presence of the greenish frothy discharge, absolutely correct. Vaginal pH is more than 4.5, absolutely correct. Strawberry spots on the vaginal mucosa and also on over the cervix. Strawberry cervix is also a feature of Trichomonas. Presence of the clue cells in the microscopic examination is a feature of bacterial vaginosis but not trichomoniasis. So except for the 3, you can mark the rest of the other options, that is 1, 2 and 4. Right? Now coming to monilial vaginitis is commonly associated with all except. What is monilial vaginitis? It is a vulvovaginal candidiasis. Monilial vaginitis is candidal infection. Right? So you need to identify a wrong statement. Prolonged antibiotic therapy, yes, definitely it can be associated because of the imbalance of the microflora in the vagina. There could be candidal overgrowth. Diabetes, yes, it is associated with monilial vaginitis. Pregnancy also could be important association, but treatment of malaria with chloroquine has no association with the monilial vaginitis. So answer is going to be option C. Next we have which of the following is not a contagious disease. So among the given options, which is not a contagious disease? If you have thought of malaria, you are absolutely correct. Please remember, contagious disease could spread from direct skin to skin contact or even through the droplets, whereas malaria is spread through vector borne. So it is a vector borne disease. So scabies, Sarcoptes scabies variominis, trachoma and also leprosy, all these are contagious diseases except for the malaria. Right? Next you have the question on a PSM. We can say which of these diseases are covered under the ESI, Employees State Insurance, according to the extended sickness benefit. So they are all going to be covered. So under this, not only this, you should also know some more conditions, among which, yes, these are the infectious conditions: interstitial lung disease, ILD, AIDS, bronchiectasis. These are also covered in the extended sickness benefit of the ESI Act. Which of the following are spread by airborne transmission among the given options? Yes, it's going to be all of them: influenza, chickenpox, Q fever, psittacosis. All of them can be transmitted through the airborne route. So that's it in this video, dear students. I hope this was helpful. If so, please hit the like button, and if you have any doubts, you can put them in the comment section. If you are not yet subscribed, please do subscribe so that you are going to get awesome dermatology related content on a regular basis. Thank you so much. All the very best for UPSC examination. We'll meet again soon in the next video. Bye bye.